The topic of my video is 4 components of ethical decision making. Making ethical decisions in the workplace. Gist et al. 1973, in an article on rehabilitation counselors, make the point that counselors in organization have little resource when disagreements arise with the organization over loyalties. The organization tends to win. They illustrate the difficulty of imposing ethical standards on organizations and how easy it is for counselors to get caught between care for the individual client and organizational demands that may sometimes not be therapeutic for clients. Workplace counselors need help in making ethical decisions that take into consideration both the individual client and the organization. 4 components of ethical decision. RISC 1984 model of 4 components involved in ethical decisions can be adapted by the workplace counselors to help them make sensitive decisions. The first is ethical sensitivity. Number 2, making an ethical decision. Number 3, implementing the decision. Number 4, living with the decision. Ethical sensitivity. The first component involves the ability to see and interpret behavior and its effects on others. It implies a realization that virtually any action may have ethical implications. Prior 1989 calls this ethical watchfulness and recommends a number of ways of enhancing ethical sensitivity. Being familiar with ethical codes and standards, making an effort to foresee ethically unclear possibilities before they actually occur, keeping an eye on the use of new techniques that may involve ethical dilemmas, examining the legal and organizational constraints of one work in relation to one's ethical and professional elegances, giving oneself time to think through ethically uncertain situations. Making an ethical decision. It is a 7-stage methodology for ethical decision. Number 1, identify the ethical problem or dilemma. Number 2, identify the potential issues involved. Number 3, review the relevant ethical guidelines. Number 4, obtain consultation. Number 5, consider possible and probable courses of action. Number 6, enumerate the consequences of various decisions. Number 7, decide on what appears to be best course of action. In identify the ethical problems or dilemma, what are the parameters of the situation? What is the source of conflict for the client or for the counselor? What are the counselor feelings about what is happening? How may the problem be clearly defined, especially where teams are emotionally charged? In identify the potential issues involved, what is the worst possible outcome? What could happen if nothing is done? What are the implications involved in this problem or dilemma? What are the rights, responsibilities, and welfare of all affected parties? In review the relevant ethical conditions, do guidelines, principles, or laws exist that are relevant to the dilemmas and may provide a possible solution? Are the counselor's values, ethics, or morals in conflict with the relevant principles or guidelines? Is the counselor aware of the effect of values and does he or she have a rationale for the behavior? Are there relevant codes, sections, chapters of books, etc., pertinent to this issue? What further information is needed to help resolve the issue? In obtain consultation, bring the situation to supervision. Talk with colleagues where appropriate. Consult line manager if appropriate. Talk to the lawyer or an expert from another profession again if appropriate. In consider possible and probable causes of action. What are the alternatives? Brainstorming without evaluating is helpful. In enumerate the consequences of various decisions. What are the implications for the client? What are the implications for others? What are the implications for the counselor? Last, decide on what appears to be best course of action. Could you recommend this action to other counselors in similar circumstances? Would I condemn this behavior in another counselor? Can I defend this behavior if it were made public? Would I treat others client in the same situation differently? Third, implementing the decision. Implementing is an ethical decision is not always easy. It can conflict with other interests, for example, career, friendship, and loyalty. Carroll, 1995, it has suggested steps to be taken when a moral decision has made and needs to be implemented. What needs what steps need to be taken to implement a decision? Which people are involved and who needs to be told what restraints are there not to implement the ethical decision? What support is needed to implement and to live with the results? Last, living with the decision. Unlike other decisions, an ethical decision can never be shown to be the correct and only course of action. Living with such a decision is about never knowing what was the right course of action to take. Even after a client has been hospitalized on the recommendation and action of the workplace counselor, the doubts are not alleviated. Counselors are still left with the thoughts that they may have acted prematurely, especially if the client reacts negatively to their decision. Carroll 1995 has defined some of the issues involved: dealing with anxiety around the final decision, letting go of the situation and the dilemma, accepting the limitations involved, learning from the experience, using personal and professional support to live with the consequences of the decision. In summary, there are no easy ways to make ethical decisions in the workplace. Counselor will want to use supervision, colleagues, ethical codes, and networks as methods of discussion and rehearsing for ethical demands of working in this setting. What is essential and recommended by most authors is the need to have a clear documented agreements on a number of areas. Clarification of potentially conflictual relationships, an understanding of an implications and limits of confidentiality in the workplace, a clear formula by which employee counselors are required to share information about clients with the organization, the need to let clients know the limits of confidentiality if there are limits. Thank you for watching my video.